Welcome to the Smile Sisters podcast, powered by the LA Dental Clinic. In each episode of the Smile Sisters, host Dr. Ozzy and Dr. Arazu Nasiri show you how you can transform and maintain your smile. The sisters explain everything you need to know about your mouth and why keeping it healthy is key to your overall health.
Welcome back
to another episode of the Smile Sisters.
Yes.
We're going to talk about something that I think is important to dentists, but also should maybe be important to patients when they're seeking treatment, for example, wisdom teeth extractions.
Or implant placement.
Or root canals.
Or root canals too. And that's the use of a CT. Traditionally, dentistry has been done with two-dimensional radiographs, which is, nowadays it's all digitized, but you basically put, what is that thing called? The
Panorex?
No, the little sensor. Oh, the sensor.
X-ray sensor.
The X-ray sensor, and then you shoot an X-ray, and the sensor captures, the teeth, the bone, everything that's hard tissue. So it won't capture gums or tongue or, anything that's soft. It won't capture.
To a certain extent. So X-rays show a difference in density in the structures that they take an image of.
Right.
So
metals and very dense stuff show up as completely white. Mm-hmm. The X-ray beam will not be able to go through it.
Yes.
Whereas things that like gums and tongue won't show at all because the X-ray beam just goes straight through it. And then things in between like bone and teeth show different gradients of kind of gray, different grays. And when we diagnose a cavity, we're actually looking for an area where you've lost tooth structure. So it's going to show as less dense than the tooth structure that's right next to it. So we can see, there's tooth here, and then all of a sudden there's this darker area because it's less dense. It must be a cavity. That's how we diagnose cavities on X-rays.
It can be a cavity. And so we need to understand the anatomy of the teeth, because teeth also have areas that are less dense in the center, that are more dense on the outside, that are,
right.
And then different things in an X-ray can also look like dark spots on a tooth, which are not necessarily cavities. So you have to really understand what you're looking at and the natural, anatomy and density.
What natural tooth should look like, and then what you are looking at, and
it's
compare
like
that.
Anomalies in that.
And then of course you look at it clinically. You look in the person's mouth and also check.
So it's just a tool. It's just one way of helping us diagnose something, but it's not the diagnosis. It's just a tool to help
in
us.
our tool belt. There's different types of X-rays. There's the smaller X-rays that show individual teeth or this, in between teeth. And then there's another type of X-ray that goes around your head. If you've ever had that done, the sensor just goes all the way around your head, and that captures your whole jaw and all your teeth in one image.
That's called a panoramic radiograph. And it's a two-dimensional image traditionally. So when you would go to the dentist, when they put the little sensors in your mouth and have you bite down and it kind of hurts your gums and they take it, those are the really small ones. And those are good for diagnosing like cavities and bone loss, so maybe for gum disease and things like that. Even infections at the roots of the teeth.
You can see tartar buildup on those.
You can, exactly. And then the Panorex was traditionally used for things like diagnosing if your wisdom teeth are impacted, because those little sensors can't go far back enough sometimes to capture the entire root of your wisdom tooth.
And your jaw and everything.
And your jaw position, your sinuses, the position of the roots of all of the teeth, so often used for orthodontic treatment as well.
So the standard of care in wisdom teeth is the use of a panoramic X-ray. However, there is a more detailed type of X-ray, which is a CT, computer tomography.
Yes.
And this X-ray actually takes multiple images and puts them together into slices, so it can actually recreate a three-dimensional view of your jaw. Still just the harder tissue, so like it's still only seeing bone and teeth and fillings and crowns and stuff like that. But it can put it together and show you a 3D view of your jaw.
Yeah, and this can be helpful for certain specific things, one of them being wisdom teeth extractions, especially wisdom teeth extractions of the lower jaw, let's say.
Yes.
Right?
Yes. So a lot of times when we are looking at a two-dimensional picture, if there's different structures that are in front of each other, for example, a tooth and a nerve, we really can't tell which one's in front of what because they're both just on top of each other because you're just looking at one image. You don't know what's in front, what's behind, and it looks like as if they're on top of each other.
Yeah, so a panoramic x-ray sort of starts on one side around your ear, and it starts taking this image around to your other ear, and then it puts it up in this flat thing. So the beam is just going through this way.
Yeah.
So if you have a tooth and then you have a nerve right behind the tooth or a nerve right in front of the tooth, it's just going to superimpose them on top of each other. So you don't really know, is this tooth in front, behind, or on top of this nerve?
Of course, as dentists, we kind of know where nerves are supposed to be. Like, it's not going to be, radically out of place. But when it comes to looking at wisdom teeth in particular, it becomes a little trickier, especially as an adult, where the roots are already fully formed. And if you don't have a lot of space, it looks as if the roots are right on top of the nerve. And we've had patients who've come in and said, I'm not a candidate for removing my wisdom teeth because the roots are right on top of the nerve.
Right. So when they take a two-dimensional image and they see that the nerve is superimposed on top of the root of the tooth. Now this happens especially with impacted wisdom teeth because they're not erupted in your mouth. They're still kind of stuck in the corner of your jaw, and this is lower teeth.
Right.
And we have this nerve, it's called the mandibular nerve, that runs inside like a tube, inside it like a tunnel, a tunnel inside of your lower jaw, and then it comes out over here of the bone, and then it's
like
under your gums, on the side of your chin.
Yeah.
And when you get, like, if you need a filling in your lower jaw, you get that numbing done, and then you're kind of numb. Your lower lip is numb to the midline, and sort of all this. That's the nerve that we're numbing. So impacted wisdom teeth can sometimes, if the roots are grown, if you're an adult and your wisdom tooth is impacted, the roots of that can be kind of sitting close to that canal where that nerve is.
Right, exactly. And so, again, on a two-dimensional x-ray, you really can't tell where is the nerve in relation to the tooth. Now, knowing anatomy, we know the nerve enters from the lingual, from the tongue side. So more than likely, the nerve's going to be more towards the tongue, the tooth's going to be more towards the cheek. But
side.
Again, we don't know 100%, especially in those confined spaces where there's not enough room. So the tooth and the nerve have to kind of like battle it out for space. And sometimes they do get like
the position of an impacted wisdom tooth can be more unpredictable.
It's unpredictable, yeah. It's not like a normal situation because there's just not enough space. And as these structures are developing, they have to kind of like figure out where to go.
Yeah.
So anyways, getting the CT is really helpful for me. I'll just talk about myself because I know dentists who are very experienced who have done like hundreds and thousands of cases with only panels, and they feel 100% confident just using a panel. But for me, I feel so much better just measuring the distance between the end of the root and the nerve and knowing exactly how far I can go. Because when we're in there, we're cutting. We're literally like drilling out the pieces of the tooth and the bone. So if we cut a little, like, I mean, we're talking millimeters here, like, maybe it's like 2 millimeters. So just knowing that you have that extra couple millimeters is very helpful to me as I'm doing the surgery. And sometimes in the middle of the surgery, I'll stop and I'll like measure the tooth and measure it on the x-ray again and just double check myself.
Yeah, for
sure.
So
it helps me be more confident because I know exactly, okay, the nerve is 2 millimeters to the lingual of the, apex of this root. So I have that much space to be able to get this tooth out.
To get it up. So, and it helps, I think, with diagnosing the ability to remove a wisdom tooth better. Because like you were saying, sometimes patients will come in and say, I've been told in the past that I'm not a candidate to have my impacted wisdom teeth out because, there's this possibility of nerve damage. Then we do a CT scan and see that no, it's actually your tooth is nowhere close to the nerve. It should be safe to remove it without damage. And that's because now we can do a CT, whereas previously they just had a panoramic radiograph, so two-dimensional, so they were superimposed.
Right.
And so whoever diagnosed it said, well, we're not going to touch that.
And like the thing is with wisdom teeth, we've talked about this before, they can be fine and not give you any problems, but whenever they're impacted, more than likely they're causing gum problems.
Yes.
It's just when they don't have enough room, they just get butted up against the other teeth. They do affect the other teeth. They do create areas for bacteria to grow. So as much as, of course, if you're fine and it's fine, of course you don't want to take it out. There's no reason to do unnecessary surgery. But a lot of times I do see patients who would benefit from taking it out because like I had a patient on Monday and there was actual food rotting behind the last molar because there was such a huge pocket there, and I was just taking out this food and I was like, this food has been there for, I don't know, it's not from today or yesterday. It's been there for a long time. And he's like, well, I was told, I'm like, yeah, but I mean, you're going to lose the other tooth as well.
So some of the consequences of an impacted wisdom tooth, especially one that's half in, half out. So there's a part of it that's sticking out and a part of it that's under your gums, but your tooth is sideways and it butts up. It's facing the wrong way. It's facing forward towards the next molar that you have. So food and bacteria, it's just a big hole there.
Yeah, basically.
Yeah, it's a really narrow, deep hole. So right, and so it's really, you can't floss it. You can't really brush it. You sometimes you can water pick and flush it out, but if that's really narrow and deep, that's also kind of hard to do.
It's an uphill battle with these things.
And then it can cause a cavity on the side of the root of the adjacent tooth. It can cause bone loss on the side of the adjacent tooth. So you might lose your other tooth. And when you get a cavity on the side of that tooth, deep under the gum line, butting up against your impacted wisdom tooth, we can't really fix that very well. It's super hard to fix. You're more likely to lose the adjacent tooth as well.
It's very hard to get to for everyone involved, for you as a patient and for us.
And for us, for sure.
So basically the use of the CT does help me personally, and I think more and more it's becoming the standard of care for all kinds of surgeries, including wisdom teeth, including implant placement, and even root canals. A lot of endodontists take CTs to be able to see all the little canals of the tooth. And again, very experienced endodontists are like, why do you need this? It's obvious, there's an extra canal there. But it's nice to actually see it, measure it, really understand it.
In some cases, a regular x-ray can show you what you need, and especially if you're experienced, you just sort of have that knowledge base to know what's going on. But in some cases, the CT helps, especially upper molars.
Yes.
There's a lot of anatomy in the upper molar area. When you take an x-ray, everything's getting superimposed.
Yeah.
So sometimes it's hard to see if there's an infection in your tooth.
And sometimes there's extra canals and things that don't show up on regular x-rays at all. You can't see them.
Another thing I've used our CT for is planning complicated Invisalign
orthodontic cases. Yes.
So we're doing this Invisalign case where our patient has a very severe skeletal underbite. So her lower jaw is really forward.
Yeah.
She's going to need surgery to push that jaw back and then bring the upper jaw forward. Well, first we have to align the teeth and then do the surgery. And we can actually take a CT scan and superimpose that over the design of the Invisalign.
Yeah.
And it's helpful when you are trying to move the teeth a lot and you want to make sure you're not pushing them out of the bone in the jaw. You
can see how far you can bring the teeth out and still have bone. It's very cool actually to see it in progress, and then you can see the software kind of bringing the tooth out, and it's okay, that was too far.
That's too far.
Let's
it's going to come
push it
out
back
of the bone.
a little bit.
Because one of the consequences of or side effects of having orthodontic treatment often is recession of your gums, right? And the reason recession happens is because the teeth were pushed out a little too far to the outside where there isn't enough bone, so you lose a little bit of gum tissue. It happens with orthodontic treatment, but now with CT scanning superimposed, maybe we can mitigate that a little bit.
Yeah.
I don't think there's enough studies out there to say Has it helped? Hasn't it? Because it's not, I don't think, standard of care to use it.
It's not standard of care,
So-
but I think it can help a lot because then, you're fixing one problem and you're creating another problem. So it's nice to be able to kind of mitigate it and not push the teeth out so much or plan for some grafting before all this kind of stuff. So the use of the CT, although not standard of care, is really useful in like many aspects of dentistry because with a two-dimensional view, we really can't see everything. And now having the three-dimensional view and also being able to incorporate it into treatment planning, it's really helpful. I like it.
Me too.
I love to see a CT on almost every patient.
I like it a lot too, especially if you have a lot of like upper crowns on your molar teeth, and maybe old root canals. Often root canals can fail, and we can't see that, and you don't feel that until there's a new infection that's quite large.
Yeah.
CT scan can sometimes help us
Find it
see things that we
sooner.
can't see on a traditional X-ray in certain teeth.
Yes. So if you're getting a wisdom tooth or an implant, even root canals, your dentist may want a CT. And now you know what it is. It's basically a three-dimensional view versus a two-dimensional view, and it gives your dentist a lot more information.
Yeah.
Yeah.
Yeah, so if you need a consultation for any of these treatments,
Yes, please check out our website. We do free online consultations, ladentalclinic.com.
okay, bye.
Okay.
Thank you for listening to the Smile Sisters. If you found this episode helpful, subscribe and leave us a review. To book a free consultation, go to ladentalclinic.com.